Today, we will focus on the Omicron variant, and we'll start with Drs. Fauci and Walensky to share the latest on what we know about the variant and what we're doing to be prepared for it in the U.S. Before I turn it over to Dr. Fauci, I want to underscore what the President said yesterday. This new variant is a cause for concern, but not panic, because we now have the tools we need to confront this variant and continue to make progress in our war against the virus. We have vaccines for everyone ages 5 and up, boosters that provide the highest level of protection, significant genomic sequencing and testing capacity to detect cases early, and life-saving therapeutics. So we have more tools than ever before. We are prepared and will continue to be guided by science and stay vigilant to keep people safe. Now over to you, Dr. Fauci.
Thank you very much, Jeff. I'm going to talk a little bit about the details of this Omicron variant. So if I could have the first slide, just to put it into some perspective, this is a list of the variants of concerns that we've had to deal with, what their lineage designation is, and what the earliest documented samples were. And of course, for today, we're going to be focusing on the latest, namely the Omicron variant that we're dealing with. Next slide. Let's take a look at some of the characteristics and what has emerged over the last several days to weeks. Quickly, it was first reported in Botswana on November the 11th and in South Africa on 11/14. The thing that got everyone's attention was the large number of mutations, around 50, much larger than previous variants, and some, according to the molecular configuration, were anticipated to impact transmissibility and antibody binding. There were variant cases that were rapidly increased, particularly in the Gauteng province of South Africa, which is Pretoria and Johannesburg, but it is also present in virtually all the other South African provinces. Confirmed cases as of yesterday was 205 in 18 countries, and just this morning, that's gone up to 226 in 20 countries. And I think you're going to expect to see those numbers change rapidly. Importantly, that has not yet been detected in the United States. It has been called Omicron by the WHO, and it was named as the 5th of the SARS-CoV-2 variants of concern. Next slide. So let's take a look at the mutations. So you've heard it now from many sources, but just to underscore, there's a very unusual constellation of changes across the SARS-CoV-2 genome, with greater than 30 of them in the important spike protein, which is the business end of the virus, particularly in its receptor binding domain, where there are about 10 mutations there. This mutational profile is very different from other variants of interest and concern. And although some mutations are also found in Delta, this is not Delta, it's something different. And these mutations have been associated with increased transmissibility and immune evasion, whereas other of the mutations have not yet been characterized as to their functional capability. Next slide. So let's take a look at what we're looking at, and then we'll get back to some of the properties. So the CDC, and you'll hear from Dr. Walensky, is implementing their surveillance program via the National SARS Strain Surveillance Program. We have now ongoing communication multiple times and information sharing between our scientists and public health officials and the South African government. And kudos to them, they have been extraordinarily helpful and transparent in sharing information with us. So the in vitro neutralization data with the vaccinees sera, convalescent plasma, monoclonal antibodies, and oral antiviral therapies, that's the question people often ask. When are we going to get information about that? We'll get to that in a moment, but generally it's going to be 2 to 4 weeks, possibly a bit sooner, depending upon when the specimens, and by specimens I mean the virus, gets to individual investigators at the CDC, at the NIH, and even in other countries for them to prepare that to be able to make a determination. And pending these data, the effect of this variant on transmission, severity of disease, and how well current vaccines treatments work remains speculative, regardless of what we're hearing in the press. Next slide. So what about these potential properties? Let's look about what we know and what we don't know. First, with regard to transmission. Obviously, when you look at the molecular configuration of those particular variants, it suggests strongly that there's increased transmission compared with the original pandemic virus. But it is difficult to infer what the relationship between this transmissibility is and Delta. Although you can suggest it might be more, we do not know until we see the dynamics of how this evolves. What about vaccine effectiveness? Now, obviously, there's significant reductions in neutralizing titer are possible. And we say that because the mutations suggest immune evasion. But remember, as with other variants, although partial immune escape may occur, vaccines, and particularly boosters, give a level of antibody that even with variants like Delta, give you a degree of cross protection, particularly against severe disease. So there's every reason to believe, as we talk about boosters, when you get a level high enough, that you are going to get at least some degree of cross protection, particularly against severe disease. And what about disease severity? Again, these are estimates, and with the small number of cases, it is very difficult to know whether or not this particular variant is going to result in severe disease. Although some preliminary information from South Africa suggests no unusual symptoms associated with variant, we do not know, and it is too early to tell. Next slide and final slide. How do we address Omicron? We've said it over and over again, and it deserves repeating. If you're not vaccinated, get vaccinated. Get boosted if you are vaccinated. Continue to use the mitigation methods, namely masks, avoiding crowds and poorly ventilated spaces, choose outdoors rather than indoors, keep your distance, wash your hands, test and isolate if appropriate. Those are the things we have been doing. We need to keep doing them. I'll stop there and over to you, Dr. Walensky.
Thank you, Dr. Fauci, and good afternoon, everyone. As I've said before, this virus is unpredictable, and we must remain ready to be proactive as new data, new science, and new variants evolve. One thing has become clear over the last 20 months. We cannot predict the future, but we can be prepared for it. And we have been doing exactly that, preparing for this moment. Today, I want to walk through with you what we've been doing at CDC to prepare for emerging COVID-19 variants and what we are doing currently to address the new threat of the Omicron variant. To be crystal clear, we have far more tools to fight the variant today than we had at this time last year. Today, we have increased our protection through vaccination for everyone 5 years and up. And we have vaccine booster doses for all adults to optimize that vaccine protection, as Dr. Fauci just said. Compared to earlier this year, when we were sequencing about 8,000 samples per week, we have increased our genomic sequencing capability, and we are now sequencing approximately 80,000 samples per week, about 1 in every 7 PCR positive cases, and that's more than any other country. And we have increased our nation's testing capacity, including expanding rapid testing for quick detection of cases. We have worked to address spread of infection through travel, during travel, through masking, vaccination, and pre-departure testing for international passengers. And we are continuously working closely with our public health partners, both here in America and around the world, to understand the evolving science of COVID-19 infection. Let me express how grateful we are to the South African government and to their expert scientists who have been open in their communication and willing to share their data with CDC and the entire world. Their collaboration has allowed us to make evidence-based decisions quickly and to ensure that we can protect as many people as possible from COVID-19. We are actively looking for the Omicron variant right here in the United States. Right now, there is no evidence of Omicron in the United States. The Delta variant remains the predominant circulating strain, representing 99.9% of all sequences sampled. Throughout the pandemic, As noted above, CDC has continuously monitored variants and vastly expanded our capacity for genomic sequencing over the past 9 months. We have received specimens from all 50 states, plus Guam, Northern Mariana Islands, Puerto Rico, and the Virgin Islands, and the District of Columbia. We're sequencing samples from these jurisdictions and from geographically diverse areas around the country, collaborating with state labs, academia, and industry partners. And our variant surveillance system has demonstrated we can reliably detect new variants, from Alpha in the start of 2021 to Delta over this past summer. We are actively putting systems in place with local and state laboratories to make detection and sequencing even faster. As we have done throughout the pandemic, CDC is evaluating how to make international travel as safe as possible, including pre-departure testing closer to the time of flight and considerations around additional post-arrival testing and self-quarantine. Currently, CDC is expanding a surveillance program with Express Check to JFK, San Francisco, Newark, and Atlanta airports, 4 of the busiest international airports in the country. This program allows for increased COVID testing for specific international arrivals, increasing our capacity to identify those with COVID-19 on arrival to the United States, and enhancing our surveillance for the Omicron variant. Thanks to our updated travel policies earlier this month, we are also actively working with the airlines to collect passenger information that can be used by CDC and local public health jurisdictions to enhance contact tracing and post-arrival follow-up should a case be identified in a traveler. As we have done throughout the pandemic, we are holding regular, even daily, calls with local county and state health officials and our public health partners. These calls include state, county, and city health officials, state epidemiologists, state laboratory directors, and partners from public health organizations. And we are conveying the knowledge we have at CDC to these partners, and we are relying on their local expertise to provide information back to us. CDC's efforts throughout the pandemic to understand and address variants such as Delta have provided us a unique experience in planning, preparing, and strategically responding to new variants as they emerge. We have the tools and surveillance in place to identify the Omicron variant. We also have the tools to prevent Omicron from increasing the strain on our society and our healthcare system. Evidence has repeatedly shown that prevention strategies work. With over 80% of our nation's counties still in substantial or high transmission, CDC continues to recommend wearing a mask in public indoor settings in these areas, washing your hands frequently, and physical distancing. These methods work to prevent the spread of COVID-19, no matter the genetic sequence. And as CDC said yesterday, all individuals 18 and older should get boosted to strengthen that protection. For the 45 million unvaccinated adults, now is the time to get vaccinated. We also know that vaccination helps protect you, your loved ones, and your community from COVID-19. And we fully anticipate this protection, at least in part, will be beneficial against Omicron. We don't know everything we need to know yet about the Omicron variant, but we know that vaccination is a safe and effective way to protect yourself from severe illness and complications from all known SARS-CoV-2 variants to date. Thank you. I'll now turn things back over to Jeff.
Well, thank you, doctors. From the start, this virus has been unpredictable, and that's why we've been preparing for all scenarios, following the science, and acting aggressively to protect the American people. Vaccines remain our most important tool in our fight against the virus. And as Dr. Fauci said, while it will take a few weeks to have a definitive information on the transmissibility, severity, and other characteristics of the new variant, existing vaccines are likely to continue to provide a degree of protection against severe illness. Today, nearly 60% of all Americans are fully vaccinated. We now have a vaccine to protect our kids, with hundreds of thousands of children getting vaccinated each day. And importantly, we have boosters available to all adults for free at 80,000 locations across the country. More than 100 million adults are now eligible for a booster shot, but have not yet gotten one. We're working with governors, pharmacies, community health centers, and other partners to get these eligible individuals their booster shots. Our message is simple. If you were fully vaccinated before June, go get a booster shot today. Getting boosted will give you the highest level of protection from COVID and this new variant. If you're unvaccinated, or if your children are unvaccinated, the best thing you can do is get yourself and your kids their shots. It's the right thing to do for your own health and safety and from everyone around you and your community. The significant progress we've made on vaccinations and boosters puts us in a much stronger position to face Omicron. We believe the current vaccines provide at least some protection against this variant, and that boosters strengthen that protection significantly. In the event that additional measures are needed, we will be prepared. We're working with Pfizer, Moderna, and J&J to develop contingency plans for modifications to vaccines or boosters if they're needed. And we will ensure that the FDA and CDC review them as fast as possible while maintaining their rigorous scientific protocols. The President has been clear that we will spare no effort to protect people. We have significant testing capacity to detect cases, and based on their preliminary review, the FDA believes the high-volume PCR and rapid antigen tests widely used in the U.S. will be effective in detecting the variant. We also have therapeutics to treat those who do get COVID, and our medical team is actively evaluating the efficacy of these therapeutics against the new variant so that we are prepared. Since the emergence of Omicron last week, public health officials and experts across the federal government have been working closely with the world's scientific community. We're learning more every day, and we'll share that information with the public. And later this week, the President will release a strategy outlining how we plan to fight COVID this winter, building on the progress we have made. Let me close with this. We are working around the clock to ensure we're doing everything we can to understand this new variant and protect the American people and continue on our path out of the pandemic. We need each of you to do your part as well. So if you're one of the 100 million individuals who are eligible for a booster, get your booster. If you have kids, get your kids vaccinated. And if you're still unvaccinated, get your first shot now.